Welcome to the American Journal of Obstetrics and Gynecology's In the Spotlight. My name is Anthony Ciccione, and I will be discussing an article in this month's journal entitled Obesity and the Risk of Stillbirth, a Population-Based Cohort Study by Yao et al. For the Perinatal Research Consortium. In the United States, the rate of obesity is steadily climbing, with 1 in 3 American adults being classified as obese. The rate in pregnant women is climbing as well, with the number of women classified as obese, a BMI of greater than 30, rising from 19.8% in 2001 to 27.2% in 2005. Obesity has been associated with multiple pregnancy-related complications, including gestational diabetes, gestational hypertension, venous thromboembolism, preeclampsia, and stillbirth. An increase in the rate of stillbirth in obese women has been reported to be 2 to 5 times higher in obese women than those of normal weight women in multiple large studies, with an increasing risk of stillbirth as BMI and gestational age increased. The purpose of this report was to determine the risk of stillbirth for ongoing undelivered pregnancies at each gestational week in normal weight and obese women. The authors abstracted data from the Washington State and Texas birth registries. The analysis was limited to non-anomalous singleton pregnancies. Maternal pre-pregnancy weight was divided into normal, defined as a BMI of 18.5 to 24.9, overweight, defined as a BMI of 25 to 29.9, Class 1 obesity, defined as a BMI of 30 to 34.9, Class 2 obesity, defined as a BMI between 35 and 39.9, Class 3 obesity, defined as a BMI of 40 to 49.9, and lastly, a BMI of greater than 50. Furthermore, the patients were divided up by gestational age at delivery. Early preterm was defined as between 30 and 33 weeks gestation. Late preterm was defined as 34 to 36 weeks gestation, early preterm as 37 to 39 weeks gestation, and lastly, late preterm as 40 to 42 weeks gestation. The outcomes were adjusted for potential confounders including maternal age, parity, education, race, level of education, smoking, chronic hypertension, and pre-gestational diabetes. There were over 2.8 million patients included in this study. At each gestational age category, the risk for stillbirth increased with increasing BMI. However, for women with Class 3 obesity or a BMI of greater than 50, instead of the gradual increase seen in other categories of obesity, the risk of stillbirth sharply increased at the end of pregnancy. In their analysis, approximately 1 in 4 term stillbirths were in women who were classified as obese. This study corroborates the findings from another large study by Noor et al. This was performed in the Danish population. However, this study revealed that the increased risk in stillbirth was present at each gestational age category and was more pronounced at term. Furthermore, the risk in women with Class 3 obesity or BMI greater than 50 sharply increased at term, especially at greater than 39 weeks gestation. These findings support the widespread practice of delivery at 41 weeks gestation used by many practitioners. While these data appear to support the delivery of women with Class 3 obesity and BMI greater than 50 at 39 weeks gestation, this must be validated in other studies before it can be incorporated into clinical practice.